Okay, let's talk about urinary incontinence in men. So urinary incontinence in women is much more common, and that's a whole separate topic that I'm not going to touch on today. For urinary incontinence in men, there's two main categories, and it's important to distinguish them. One category is urge incontinence, and that is where you get a sudden urge to get to the bathroom, and if you don't get there in time, you might leak a little bit. The other one is stress incontinence. That's where if you cough or sneeze or pick something up, a little bit of urine comes out right at that time before you even notice it. They're very different. They have different causes and different management, so it's important to distinguish them. Some people have a component of both. We call that mixed urinary incontinence, and we sort of have to tease out which one is the primary player and work on those together. So I'll start with the urge incontinence because that's the type that is more common. So urge incontinence is often related more to the bladder than the prostate or any sort of issue with the sphincter itself. So urge incontinence happens because the bladder is overactive for whatever reason. And so you get this diagnosis of overactive bladder that can cause the urge incontinence. And most of the time, this is related to lifestyle, primarily diet, but smoking has a big impact as well. Basically, anything that gets into your bloodstream, your kidneys filter it out of your blood and put it into your urine. So then your bladder sits with this chemical soup of whatever is in your bloodstream. So smoking can cause urinary frequency and urgency because of all the chemicals that are in cigarettes, but also with cigars or marijuana or the electronic cigarettes. All of that can cause the urgency and urge incontinence. The other one that's common is alcohol. Alcohol, in addition to irritating the bladder, is a diuretic or like a water pill. It can cause the kidneys to produce a lot of urine very quickly. And this can cause you to have that sudden urge when the alcohol kicks in. The most common one by far is caffeine. Caffeine, like alcohol, is a diuretic and it can cause your kidneys to produce a lot of urine very quickly. The caffeine can also irritate the bladder and cause this frequency and urgency. So coffee is the most common culprit, but tea has a lot of caffeine too, unless you're having uncaffeinated tea. And even decaf tea or decaf coffee can still irritate the bladder. Uh, Soda obviously has caffeine usually, and even if it doesn't, it usually has sugar. And even if you have a sugar-free soda, it usually has artificial sweetener. And all of those things can also irritate the bladder, cause you to urinate more frequently. Sometimes there's a component of spicy foods playing in or acidic things like orange juice that play a role. Sometimes there's a component of constipation that's playing a role. Sometimes obesity can make it worse, but usually it's an issue of diet and what you're putting in your body that's causing you to have so much urgency and frequency with urination. So the first step of treatment is obviously lifestyle modification to cut those things out and see how your symptoms improve. Obviously, there's some component of workup. You're going to want to have a urine test done to make sure we're not missing anything like blood or bacteria or sugar in the urine. But if you've done those lifestyle changes and all the testing seems to come back normal, there are medications for overactive bladder, medicines that basically work to relax the bladder to cause less of that spasticity. And I won't get into the different kinds of medications and the issues with potential side effects of different medications, but just know that every medicine that you take, any pill that you take, has a potential for side effects. And these pills only work while you're taking them, so they don't really cure the problem. Right? So if I see somebody, say in their 20s with this issue and they're drinking a Red Bull every day, you're much better off to cut the Red Bull than to take another pill every day for the rest of your life. And usually with that, lifestyle changes plus or minus pills, the vast majority of men can have their urge incontinence fixed. It's very rare that we have to do more aggressive treatments for that. Then we move over to stress incontinence. Now, we pretty much only see stress incontinence in men who've had some type of prior procedure, typically a prostate procedure like removal of the prostate for prostate cancer or another surgery on the prostate to help you urinate better. Sometimes can be associated with prostate radiation or other urologic procedures that affect the sphincter mechanism. So this one is more of a plumbing issue. The sphincter that is meant to close off the urethra and get you dry has been damaged in one way or another. And it's a lot more difficult to fix this because this is a structural issue. The first line of treatment is typically Kegel exercises to help strengthen the pelvic floor muscles, which are your external sphincter. And this does work usually within the first year of whatever prostate treatment you had. But once it's been over a year, these Kegels usually don't make much of a difference. And it's really not going to get much better on its own from that point on. There's really no pills that help with this type of stress incontinence. Once you get to the point of stress incontinence, after a year after these types of procedures, the only way to really fix it is with another procedure. And there's different procedures we can talk about in other videos, go into more detail, but there's a sling is the most common one for mild incontinence. The artificial sphincter is more common for severe incontinence. There's a newer device called the ProAct balloon that can be used for all stages of incontinence. So that the nuances of those treatments, you have to go and talk with a urologist about, who's going to review your whole history and do more testing. But that is the stress incontinence that's completely different from the urge incontinence and has completely different treatment options. So if you're a man who does have some type of incontinence, you can try just doing the lifestyle changes if you feel like it's mainly an urge incontinence issue, but you should probably see a urologist to have some of this testing done and figure out if maybe you need some additional treatments.